My name is Yvette Bennett, and I am a certified orthopedic nurse practitioner. I have been with the Center for Bone and Joint Disease for about 2 years now. I have been a nurse practitioner since 1996. I initially trained in Chicago, which is where I'm from, but I've been in the Tampa area now for almost 16 years. Osteoporosis is first of all, the most common bone disease in humans. More specifically, it is a metabolic bone disease that's characterized by decreased bone density or thickness of bone and poor bone quality. It is a combination of those two that make it osteoporosis, that makes you have poor bone health. A lot of people think that just by having a low bone density, that alone, or having normal bone density, that alone makes them have good quality of bone, and that's not true. Osteoporosis is not just how thick your bones are, but the quality of the makeup of the bone inside. So those two sort of go hand in hand for diagnosis of osteoporosis.
You are here because you have either had a fracture or because your orthopedic surgeon, primary care provider, or another specialist believes you're at risk for a fracture. Many of these fractures can occur while doing simple household chores, during sports activities, or even just walking up and down a stairway. We are here to help you understand and maintain your bone health. So whether you are here because you have already had a fracture or could be a risk for one, we will help you to learn about your bones and the right ways to take care of them. During your first visit with our facility, we will take you through your bone history, evaluate your risk, and discuss treatment options. You will be asked whether you've had a bone density test before, whether you're taking calcium or vitamin D supplements, or whether you have been told you have bone loss, osteoporosis, or osteopenia, a precursor to osteoporosis. You will receive a physical examination and take laboratory tests. You may get x-rays or a bone density scan. You will be provided with materials to help you better understand bone health and suggestions to help you avoid injury. At a follow-up visit, 1 to 3 months later, your provider will evaluate and adjust your treatment to ensure future bone health. Did you know that your bones are made up of living tissue, or that every cell in your bones is alive and continually changing? Old dead cells are carried away and replaced with new, healthy cells. As you age, the removal and replacement of cells slows down. Your body becomes less capable of replacing lost cells and bones become thinner. This is normal. There are 2 key nutrients that can both help your bones and prevent osteoporosis, a disease in which the bones become weaker and can more easily fracture. Those 2 nutrients are calcium, which can be found in dairy products, dark leafy greens, and beans and legumes, among others, and vitamin D, which is often found in fortified milk or yogurt, and fish, such as salmon, tuna, and herring. Another important way to prevent bone loss is exercise, which builds bone strength. One caution: please check with your healthcare provider before beginning any exercise regimen. Our facility is dedicated to your health. Whatever your concerns are, having had a recent fracture or having been diagnosed at a risk for a fracture, we will help you understand your bones and learn how to live a healthy lifestyle that reduces your risk of future injury.
Symptoms of osteoporosis, really, truly, there aren't many at all because it is a silent disease. Oftentimes, you first learn you have it when you fracture a bone. Only about 20 to 25% of those patients are actually having their bone health evaluated. So people are having their fragility fractures, getting their fractures fixed, and truly no one is really taking care of their underlying bone health and their osteoporosis. So that is why the Center for Bone and Joint Disease has decided to start treating the whole patient. We are going to be implementing a post-fracture prevention program. This is a secondary osteoporosis prevention program as opposed to a primary prevention program, which is what most primary health care providers do. A secondary prevention program is basically done once you've already fractured. So you are in our system now because you've fractured, you've come in for orthopedic care, and now we are going to take care of your fracture, but in addition, we are going to take a look at your underlying bone health, because if you don't treat the underlying bone health and you have a fragility fracture, chances are you will fracture again. A lot of patients will be concerned about payment for this bone clinic. Most health insurance and Medicare do cover these services of bone health. In fact, they are encouraging providers, especially in orthopedics, to provide bone health to look at the secondary osteoporosis prevention in order to increase the quality of care that we are giving within the specialty.